Let's discuss the Chong Mai penetrating vessel, the clinical significance of the 5 branches. The internal branch, the two most important aspects of this branch are that it arises inside the abdomen in between the kidneys and that it flows through the uterus. This means that the penetrating vessel is functionally related to the kidneys and the uterus very closely. For this reason, it is very important vessel in gynecological problems. Although the classics always says that this vessel flows through the uterus, it could be postulated that in men it flows through the prostate. Arising from the space between the kidneys, the penetrating vessel together with the burning and directing vessel determines the 7 and 8-year life cycle of women and men, respectively, and is closely involved in the transformation of the kidney essence into Chong Mai, that is menstrual blood in women and sperm in men. All the points of the penetrating vessel on the lower abdomen, which are on the kidney channel apart from stomach 30, therefore affects the kidneys and the uterus. Abdominal branch, the penetrating vessel flows through the kidney points on the abdomen up to kidney 21. It then disperses in the chest. The chest indicated in the ancient text includes the breast. The pathology of rebellious chi of the penetrating vessel affects the abdominal branch of this vessel, causing a variety of different symptoms from the lower abdomen to the chest, breast, throat, and face. The abdominal branch of the penetrating vessel penetrates the membrane of the abdomen, and some of the symptoms of rebellious chi of the penetrating vessel are due to the tension and tightness of the membranes, fullness, distension, and pain of the abdomen. Next, the head branch. As it flows over the throat, rebellious chi of the penetrating vessel often causes the feeling of lump in the throat, which therefore is not always related to the liver chi stagnation. According to chapter 65 of the spiritual axis, the penetrating vessel brings chi and blood to the chin area, and in women losing some blood with menstruation. The penetrating vessel has a relatively less blood than chi in this area compared to men. The lack of blood in this area is the reason why women do not have a birth, as men have relatively more blood on the head branch in the penetrating vessel. This blood promotes the growth of hair in the face. Interestingly, facial hair increases after the menopause as due to the stoppage of the menses. This branch of the penetrating vessel has relatively more blood than before, and this promotes the growth of hair. The bird branch of the penetrating vessel is responsible for the contradictory feeling of heat of the face and rebellious chi of this vessel. Contradictory because it is associated with cold feet. Next, the spinal branch. The spinal branch of the penetrating vessel starts from the friend 1 and flows inside the lumbar spine. This branch accounts for the menstrual pain that is sometimes felt in the lower back. Next, the descending branch. The descending branch of the penetrating vessel flows from stomach 30 down the inner aspect of the leg to the internal malleolus and the foot. On the foot, it separates one branch joining the kidney channel, the other the liver channel, and ending at liver 3. The descending branch of the penetrating vessel is significant in practice for several reasons. Firstly, through the descending branch of the penetrating vessel, the kidneys bring yin chi down to the legs. The passage from chapter 38 of the spiritual axis quoted above is actually preceded by a question from the Yellow Emperor wondering why the yin leg channel flows from the feet to the abdomen and chest except for the kidney channel that descends. The answer clarifies that it is not the kidney channel but the descending branch of the penetrating vessel that descends. This implies that the penetrating vessel has the important function of ensuring the descending of yin to the legs. This means that it is the vessel to treat whenever there is a deficiency of yin in the leg, as for example, in restless leg syndromes. The descending branch of the penetrating vessel is therefore an important way in which kidney chi descends to the legs. Secondly, through its descending branch, the penetrating vessel influences all three yin channel of the leg, and it strengthens the interaction between the liver, spleen, and kidney channels. It is probably also because of the penetrating vessel that spleen 6 is a meeting point of the three yin channel of the leg. This means that a pathology of the penetrating vessel may affect the liver, spleen, and kidney channels on the leg. Vice versa, whenever we use the three yin channel of the leg, especially in combination, we are affecting the penetrating vessel as well. Therefore, penetrating vessel points such as kidney 11, kidney 12, kidney 13 affect the circulation of qi in the three yin channel of the leg. Thirdly, the descending branch of the penetrating vessel brings qi to the feet, warming them. Therefore, cold feet could be a pathology of the penetrating vessel that is its qi failing to descend. Fourthly, the descending branch of the penetrating vessel ends at liver 3. This means that this points up on the penetrating vessel. Every time we use liver 3, we are activating the penetrating vessel. It is also for its connection with the penetrating vessel, which is the sea of blood, that this point is such an important point to move blood in the uterus. Fifthly, it is probably because of the connection with the penetrating vessel and its integration of the three yin of the leg that spleen 6 affects the uterus and is effective in many gynecological conditions. Sixthly, fungal infection of the big toe may be a symptom of penetrating vessel pathology.